Early warning signs of colon cancer you should not ignore. Colon cancer is a growth of cells that begins in a part of the large intestine called the colon. The colon is the first and longest part of the large intestine. The large intestine is the last part of the digestive system. The digestive system breaks down food for the body to use. Colon cancer typically affects older adults, though it can happen at any age. It usually begins as small clumps of cells called polyps that form inside the colon. Polyps generally aren't cancerous, but some can turn into colon cancers over time. Polyps often don't cause symptoms. For this reason, doctors recommend regular screening tests to look for polyps in the colon. Finding and removing polyps helps prevent colon cancer. If colon cancer develops, many treatments can help control it. Treatments include surgery, radiation therapy, and medicines, such as chemotherapy, targeted therapy, and immunotherapy. Colon cancer develops when tumorous growths form in the large intestine. It often produces no symptoms in the early stages, but people should see a doctor if they notice persistent changes in bowel habits. The colon, or large intestine, is where the body draws out water and salt from solid waste. The waste then moves through the rectum and exits the body through the anus. Rectal cancer originates in the rectum, the final several inches of the large intestine, closest to the anus. What is colon cancer? Colon, colorectal, cancer starts in your colon, large intestine, the long tube that helps carry digested food to your rectum and out of your body. Colon cancer develops from certain polyps or growths in the inner lining of your colon. Healthcare providers have screening tests that detect precancerous polyps before they can become cancerous tumors. Colon cancer that's not detected or treated may spread to other areas of your body. Thanks to screening tests, early treatment, and new kinds of treatment, fewer people are dying from colon cancer. What are the signs and symptoms of colorectal cancer? Colorectal cancer might not cause symptoms right away. In fact, many of the symptoms of colorectal cancer can also be caused by other problems, such as infection, hemorrhoids, irritable bowel syndrome, or inflammatory bowel disease. It's important to get checked if you have any of following problems. In many cases, people who have these symptoms do not have cancer. But you should talk to your doctor if you have any of them so the cause can be found and treated. The symptoms of colorectal cancer in women and men are: a change in bowel habits, such as diarrhea, constipation, or narrowing of the stool, that lasts for more than a few days. A feeling that you need to have a bowel movement that is not relieved by having one. Rectal bleeding with bright red blood. Blood in the stool, which might make it look dark brown or black. Cramping or abdominal, belly, pain. Weakness and fatigue. Losing weight without trying. Early symptoms. Colon cancer often causes no symptoms in the earliest stages, but symptoms may become more noticeable as the disease progresses. If people do have symptoms in the early stages, they may include blood in the stool, a change in frequency or type of bowel movements, such as diarrhea, constipation, or narrow, ribbon-like stools, the feeling of not emptying the bowels after a bowel movement, abdominal pain, cramping, or bloating, nausea and vomiting, anemia, due to intestinal bleeding, loss of appetite, fatigue and weakness, unexplained weight loss. Often colorectal cancer doesn't cause symptoms until it has grown or spread. That's why it's best to be tested for colorectal cancer before ever having any symptoms. Colorectal cancer that's found early through screening, before you have symptoms, might be easier to treat. Screening can even prevent some colorectal cancers by finding and removing precancerous growths called polyps. Causes. Usually, cells follow an orderly process of growth, division, and death. Cancer can develop when cells grow and divide uncontrollably and do not die at the normal point in their life cycle. Researchers are unsure of the exact cause of colon cancer, but certain factors may increase the risk. Cancer happens as a result of changes in DNA within cells. Certain genes called oncogenes help cells stay alive, grow, and divide. Tumor suppressor genes help regulate cell division and cell death. Changes to DNA can affect oncogenes and tumor suppressor genes, resulting in multiple gene changes that may lead to colon cancer. Polyps are growths that form on the inside of the colon. Polyps are non-cancerous, but cancer can begin with some types of polyps. If a person has a type of non-cancerous polyp called an adenomatous polyp, they have an increased risk of developing colon cancer. These polyps form on the inner walls of the large intestine. Cancerous cells may spread from malignant tumors to other parts of the body through the blood and lymph systems. These cancer cells can grow and invade healthy tissue nearby and throughout the body in a process called metastasis. The result is a more serious, less treatable condition. Lifestyle choices that are risk factors for colon cancer. Smoking, using tobacco products, including chewing tobacco and e-cigarettes, increases your risk of developing colon cancer. Excessive alcohol use. In general, men and people AMAB should limit beverages containing alcohol to 2 servings a day. Women and people AFAB should limit beverages containing alcohol to 1 serving a day. Even light alcohol use can increase your risk of developing cancer. Having obesity, eating high-fat, high-calorie foods may affect your weight and increase your risk of colon cancer. Having a diet that includes lots of red meat and processed meat. Processed meat includes bacon, sausage, and lunch meat. Healthcare providers recommend you limit red meat and processed meat to 2 servings a week. Not exercising. Any kind of physical activity may reduce your risk of developing colon cancer. How does the doctor know if it's cancer? If you have symptoms that might be caused by colorectal cancer, or if a screening test shows something not normal, your doctor will want to do more testing to find the cause. Your doctor will ask about your medical history to learn about possible risk factors, including check for symptoms and. It's important to know your family history. You will also be asked if you're having any symptoms and, if so, when they started and how long you've had them. You might be able to have a virtual visit to talk with your doctor about symptoms or risk factors that might be worrying you. But, depending on your symptoms, your doctor might want you to schedule an in-person visit so you can be examined. As part of a physical exam, your doctor will carefully feel your abdomen for masses or enlarged organs, and also examine the rest of your body. You may also have a digital rectal exam, DRE. During this test, the doctor inserts a lubricated, gloved finger into your rectum to feel for any abnormal areas. Your doctor may also want you to get more tests such as colonoscopy. A colonoscopy is a test where a thin tube with a light on the end is put through the anus into the rectum and colon to look closely at the inside. If any abnormal lump, mass, or growth, polyp, is found, a piece of it can be taken, a biopsy, and checked in the lab for cancer cells. Biopsy. During a biopsy, the doctor takes out a small piece of tissue where the cancer might be. The tissue is checked for cancer cells. This is the best way to know if you have cancer. CT or CAT scan. A CT scan is like an X-ray, but the pictures of your insides are more detailed. CT scans can also be used to help do a biopsy and can show if the cancer has spread. Ultrasound. For this test, a small wand is moved around on your skin. It gives off sound waves and picks up the echoes as they bounce off tissues. The echoes are made into a picture on a computer screen. It's used to help find cancer and see if it has spread. Gene and protein tests. The cancer cells in the biopsy tissue might be tested for genes or proteins such as KRAS, BRAF, MMR, and MSI. Knowing which genes or proteins your cancer has can help the doctor decide if treatments like targeted therapy or immunotherapy might help. Other tests, such as MRI scans, X-rays and blood tests may also be done to look at how big the cancer is and whether it has spread. What happens if I have colorectal cancer? If you have colon or rectal cancer, treatment depends on which type of cancer it is, how big it is, and whether it has spread. Treatment may include surgery, radiation, chemotherapy, targeted therapy, or immunotherapy. Many people get more than one type of treatment. It's important to talk openly with your doctor and ask questions if you don't understand something. Superfoods for fighting colon cancer. Beans and legumes. Beans and legumes are hailed as superfoods in the fight against colon cancer. Black beans in particular raise levels of specific fatty acids that protect against the growth of cancer cells. Berries. Berries are full of antioxidants and phytonutrients that are good for your health. Black raspberries contain very high levels of anthocyanins, which slow the development of malignant cells. Carrots. Carrots are full of beta-carotene, which researchers believe slow the growth of abnormal cells. There is also evidence to suggest that carrots contain an abundance of nutrients and vitamins that protect your body against many types of cancer.